Mockingbird sits in the market is that we fill the gap in the current traditional licensing and credentialing life cycle. We basically pick up where the traditional credentialing companies leave off. And we're the first to market in this, so much so that we have quite a few partnerships developing and full integrations developing with credentialing companies so that we can bring greater clarity and confidence to clinicians during this process. Good afternoon. Thank you, Startup Health, for inviting me and Mockingbird to present to everybody. My name is Madom. I'm the co-founder and CEO of Mockingbird, and I'm trained and have spent my career as an orthopedic spine surgeon. And I'll tell you, I'm fed up with not having the tools that I need to get my non-clinical work done. Every year, I spend less time taking care of patients, and anybody who has friends or family in healthcare knows that this is an issue. I spend more time being bogged down with non-clinical tasks, and I have more requirements with no tools to get the work done that I can just go and be a surgeon. So when we started Mockingbird, our goal was to put clinicians back into the center of how healthcare is delivered and creating an infrastructure to really help them do the things that they want to do and focus on what's most important to them. We clinicians need a platform that manages all state, board, and expiring credentials with specific rules that puts the education right in their hands so that they can complete it. It's something that manages timelines and rules in the background and provides the education that keeps me compliant, and it makes me better at my job, not just checks a box, which is currently the situation. A process that doesn't take up the valuable time of my administrators who are chasing me down for a spreadsheet just to stay in compliance. Mockingbird is a web-based platform and a mobile application that automates and simplifies this whole process. Both clinicians and administrators have their own dashboards with multiple tools and ability to engage the process at any time. We currently support MDs, DOs, doctors of osteopathic medicine, nurse practitioners, physician assistants, and registered nurses. We have a roadmap of all of the remaining healthcare professionals is on our product roadmap for the remainder of this year. So where Mockingbird sits in the market is that we fill the gap in the current traditional licensing and credentialing life cycle. We basically pick up where the traditional credentialing companies leave off. And we're the first to market in this, so much so that we have quite a few partnerships developing and full integrations developing with credentialing companies so that we can bring greater clarity and confidence to clinicians during this process. And by filling this gap, we can manage the data that they need to renew a license or certification and control it in a unified platform, while also curating the education specific to our users and their unique set of requirements. We have a patent pending rules engine that allows us to have unique insight into what our users actually need to learn to remain in practice. What's most exciting to us is that we have traction in the digital health space, because that's where the need is most acute right now. And in their words of many of our current customers, we need a tool like yours to actually scale, because you can't go ask a clinician to add 20, 30, 50 licenses, and they have no way to do it. But for Mockingbird, the way that we look at this is really act one for us. We are now building to reach all 10 million healthcare professionals who have these similar needs. But what we're looking is to scale with an infusion of capital so we can start towards our second act. We want to own the entire licensing life cycle and deliver customized CME to our users that goes beyond compliance. Our end goal is to deliver education that is different than the way it's currently consumed. We want a platform where healthcare professionals can learn in real time and know what they need to know. In the future, we want a system that educates them based on their quality data, on what types of problems and pathologies they encounter on a daily basis, and even fill their blind spots, because sometimes we don't know what we don't know. As you can see, we have early traction in the digital health space with many partners in that space, and we are growing our ARR monthly. We are currently catching up to our current contracted ARR of 1.6 million. And on the right, you can see there is a couple credential companies that we are currently working on integrations with. We are currently raising a $10 million Series A round to accelerate product growth, primarily for our rules engine, to develop and deploy a customized CME product that utilizes data science, and to further progress our partner integrations. So we actually don't, all of our data sources either come from the credentialing partner that we have, or we can use, that the organization, we're designed as a B2B. So we can take that data directly by building an integration. We are built as an open API, or we can get that data directly from the organization that they supply to us directly. When it comes to healthcare, in our current state, we spend a lot of time just not taking care of patients. We spend a lot of times in front of a screen for ourselves, and a lot of times not looking at a patient. But then even when we leave the clinic for the day, we have so many more activities to do to actually continue to practice. The main problem we're attacking is that I have to keep multiple state licenses the way I practice. Some people only one state license. I have a board certification, but many people have multiple. I have many registrations, whether it be my drug enforcement or my advanced cardiac life support. There are a variety of things, and every clinician has a different set that they need. All of these have education that comes along with it that you have to continue to do. And the rules for that education changes almost every year, because they're adding things. All we want to do is be able to keep everything in one place and supply you the education that you need to stay compliant, but then use that platform to grow off of, to say, it's not just about what you need to learn, how about what you want to learn? We find a lot of our users are just learning the same thing over and over again, and not really engaging in continuous learning in a meaningful way. They're only checking a box.